Hi there, I'm Dr. Emily Porter in Austin, Texas, and I'm here to talk today about low libido. Low libido is defined as a lack of sexual interest or desire. It is irrespective of age, although a lot of people find that when their testosterone levels start to drop as soon as their early 20s, that they become more and more affected. Women get affected by just not having sexual desire anymore. A lot of time, women's birth control pills can be binding up their testosterone, or their production of testosterone has just started to slow and it actually will start to level out. Men, it can happen just with age. Low libido testosterone can happen for lots and lots of various reasons, and sometimes it's just aging. So in the past, there have been testosterone shots that you can do. Men, women can do them. Creams, shots. Some people don't like to get a needle. They certainly don't like to inject themselves, and they don't want to have to go to the clinic every week or twice a week or a couple times a month to get a shot. And it takes a lot of time to do that. And then creams can be messy if you're a man using a cream and you don't want to get it on your child or your wife or your pet. So what's new is not really new, but it's becoming more in vogue, is bioidentical hormone pelleting. And they've been using it safely in Europe for 40 plus years. They've been doing pellets, but in the US it's more recent than that. And what bioidentical hormone pelleting does is that we're replacing testosterone with subcutaneous, which is a fancy way for saying under the skin, testosterone pellets that are natural, that are plant-based, and they're painless. You don't feel them when they're there. They'll last for 3 to 6 months, depending on gender and activity level, and they will provide a steady stream of hormones, specifically testosterone, to men and women to allow them to have the libido that they want. What's not possible is to fix a libido that is coming from a more psychological problem. It's not coming from a testosterone problem with bioidentical hormones. If your lack of libido is due to trauma or stress or some medical condition that's not related to testosterone, then testosterone therapy might not help if there's a psychological component. But what is possible is to have a 40-year-old woman who loves her husband but really wants to be intimate with him again, but just can't figure out why she doesn't have desire. I can fix that woman. I can fix a man who has testosterone of 250, who has erectile dysfunction as a result, who now can make love to his wife. So there's lots of possibilities. I personally have these pellets done myself, and I do them to a lot of my loved ones, and I have lots of very, very happy patients over the last 3+ years doing these therapies. So I hate to see people who are in a loving marriage but have a sexless marriage or have lack of desire, but I love to see people be intimate if they want to, and I love to see happy couples and the way that a positive sex life can affect the rest of your life and the other aspects of your life. So if you think I can help you if you're not where you want to be sexually due to lack of libido, please reach out via our website or give us a call.